Omicron.
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 The fast-spreading Omicron variant. It causes milder illness compared with previous versions of the coronavirus, and that has furthered the idea that COVID-19 poses less of a risk than in the past.
You know, be concerned about Omicron, but don't be alarmed.
Some are asking, why bother avoiding the virus now if everybody will be exposed sooner or later? But here's why experts say you should still avoid catching Omicron. You could still become very ill. The extraordinary spread of Omicron in many countries means that in absolute numbers, more people will experience severe disease. Recent data from Italy and Germany show that people who are not vaccinated are far more vulnerable when it comes to hospitalization, intensive care, and even death.
Virtually everybody is going to wind up getting exposed and likely get infected. But if you're vaccinated and if you're boosted, the chances of you getting sick are very, very low.
And you could still infect others. While you might become only mildly ill, you could still pass the virus to someone else at risk of critical illness. That's even if you have antibodies from prior infection or from vaccination, according to experts.
Let's be clear. While Omicron causes less severe disease than Delta, it remains a dangerous virus, particularly for those who are unvaccinated. Almost 50,000 deaths a week is 50,000 deaths too many.
Omicron's long-term effects are also still unknown. Infections with earlier variants of the coronavirus sometimes have caused the lingering, debilitating long-haul COVID syndrome known to many as long COVID. It's still also unclear whether Omicron will have any of the silent effects seen with earlier variants, such as self-attacking antibodies, sperm impairments, and changes in insulin-producing cells. Medications are also in short supply. Omicron treatments are so limited that doctors have to ration them. 2 of the 3 antibody drugs used during past COVID-19 waves are ineffective against this variant. The third, sotrovimab from GlaxoSmithKline, is in short supply, as is a new oral antiviral treatment called Paxlovid from Pfizer that appears effective against Omicron. What that means is if you get sick, you might not have access to treatments. Hospitals are also filling up. In the United States, for example, hospitals have been overwhelmed by the surge of COVID-19 cases driven by Omicron, and staff shortages have compounded the problem. Jodie Parsons is a nurse in Ohio.
I've never seen anything like it since I've been a nurse. When we had our first surge, when the pandemic first started, it was nothing like it is today. I would say we're surging more today in this hospital than we were when it all started a year ago, or 2 years ago.
The record number of infected patients has meant that hospitals have had to postpone elective surgeries and cancer treatments. And during past surges, overwhelmed hospitals were unable to properly treat other emergencies like heart attacks. Finally, more infections mean more new variants. Omicron is the 5th highly significant variant of the original SARS-CoV-2. And it remains to be seen if the ability of the virus to mutate further will slow down. High infection rates also give the virus more opportunities to mutate, and there's no guarantee that a new version of coronavirus would be more benign than its predecessors.